Good evening and welcome to I'm Listening, Stay Connected. I'm Listening is a 24/7, 365 initiative that works to destigmatize mental health. If you want to join the conversation, you can always do so by sending your questions into our Loveline DMs on our IG page or by tweeting your question at the hashtag I'm Listening. We've got a great show planned for you. We have actor Daniel Newman and Dr. Daniel Newman, psychiatrist and also author of a book about mental illness. So we talk about the intersections all during the show about COVID, self-isolation, the pandemic. And the whole purpose, again, is to get people to talk about their mental health. That's the way that we're going to get through this. We've talked, ongoing about isolation. And in psychology, we also know the impacts on us psychologically, biologically, on self-isolation and being removed from other individuals. But now we're encountering a new syndrome, and this one is called enforced togetherness. Now, we really don't know what's going to come out of this. In a normal time of our lives, we have the choice as to who we spend time with, for how long. We have access to different coping mechanisms. We can leave the home. But again, we're being forced to engage those around us that we are self-isolating with, and not everyone lives in a home that's large enough to take physical, actual space. Now, we're looking at what's coming out of China because they're ahead of us in terms of the enforced togetherness, and they're reporting higher rates of divorce. And we're seeing here in the States some higher rates of domestic violence as well. So it's something we definitely want to take seriously. What happens when we are forced to be around individuals around the clock is that it can become somewhat of a psychological pressure cooker. And what that means is everything gets amplified. So a lot of us need to self-regulate, which means taking time away from others and communication and the topics as a way to kind of soothe ourselves. We're definitely in a fight or flight mode. And when you can't flight, often what we're left with is just the fighting. So what are the things we need to do? Well, first off, I'm reminding everyone, if you're in a relationship with someone, and I'm talking family members, children, employees, and they're AKA pushing the pushing the gas pedal, you got to be the brake. We need one person in all relational dynamics to kind of slow everything down. Also, and this is not something that all my patients that I'm working with want to hear me remind them, is we have to let some things go. Yeah, that's right. We're not brushing it under the bed. We're not ignoring it. We're going to come back to it, but you got to let some stuff go because now is not the time for those high conflict conversations. Also, we can be preventative, making sure you're building in throughout the day time away from those around you before that intense pressure cooker happens. And as always, building in just joy and fun as a way to kind of buffer all the serious things that are happening around us. But now joining us is actor Daniel Newman. What's going on, Daniel? Welcome to the show. How are you?
How you doing, sir?
I'm hanging in there. How is your mental health?
Mine is very, very blessed in a personal sense and very, very stressed and frustrated in a public sense.
Now, talk to me about the piece about the public sense. What's that about?
Seeing what's going on in our culture, working with, city council, working against our current situation with Kemp. And, we have a lot going on, a lot of really important decisions to make quickly.
Yeah. And so let's just kind of jump, I guess, into that. As someone yourself who was impacted by COVID-19 personally, what are your thoughts about what's happening around the country? Florida's opened the beaches, Georgia's letting people get back to the movie theaters, and even Kentucky was going to be opening up in the same week that they hit the highest number of COVID infections.
Yeah, that is a complete nightmare.
Yeah, that's real.
Yeah. I've been beating a dead horse since the beginning. Testing, and it just is mind-boggling to me that. I'm really, really grateful that now you're seeing all of the politicians and the media start saying, "Oh, we need to get testing," but it's like, come on, where's everybody been? It's been months and months with no public pressure. Even though we're seeing, South Korea and Germany and Iceland just knocked out testing. They were so adamant about it from day one to isolate it, to quarantine the people that had it, to do all of the tracing and being able to notify people exposed. It's not rocket science. You find people that are exposed, you keep them from the rest of the, population until it's gone. You lock it down. And the fact that America just kind of, didn't do that is really, really painful.
Yeah, I can hear the frustration in your voice, and that's coming into my practice as well, where people also, in addition to that, aren't sure where to get the best information, right? Because at one hand, we have the administration sometimes saying one thing, then we have local governors saying something else. The CDC is swooping in with a third opinion. It gets really confusing.
And the mayor's saying the opposite of what the governors are saying.
Yeah, it's a little bit of a battle.
Yeah. Yeah.
So what are your thoughts on healthcare? Because I know, again, when we had Bernie, he was pushing for universal healthcare. And I know your backstory. For those that aren't familiar with it, you went to get tested, you received a bill, the test wasn't even processed. So talk to us about your thoughts on that situation.
Yeah. I am, I guess I'm going to have to come up with my words. They're blanking out on me right now, but I love a capitalistic system as long as it takes care of everybody that is giving in that, and right now we're in this, or the bubble from 2019 of capitalism, which was, not being compassionate. If you're giving people jobs, but you're forcing them to work for minimum wage to compete against other people, and then you're also playing the game with Trump and with everybody keeping all of the bailouts, keeping all of the billions of dollars that are floating through. And then even right now, you're looking at the small business fund, which is supposed to help small businesses. And then you find out hedge funds, billionaires were getting the money. 95% of small businesses didn't get a dime. And Shake Shack, you're seeing these giant corporations that got the money. And you're just like, it's so infuriating that we had huge tax cut for the rich before, and everybody was kind of upset but didn't do much about it. Then we have small business fund where 95% of the small businesses aren't getting it. Then you have, the stimulus with $1,200. $1,200 times all working adults in America is somewhere around 250 billion. So you're having trillions of dollars that are basically just for the middle class to repay because, Amazon's not paying those taxes. And all of this money is just evaporating into thin air, going to wealthy people, while our lower class and middle class should at the very least be having health care and education taken care of.
Yeah, I think that's what was frustrating. We were watching people like Bezos buy his fourth $4 million or $40 million condo in New York. We saw Geffen on his private yacht out in the ocean, and celebrities are singing us songs, and that's really great. But I think everyone's saying, if you have the wealth, please distribute that a little bit. There's people that are struggling to pay their rent and their bills.
Yeah, enormously, absolutely. Well, I don't know if I want to talk about that.
Yeah, no. I mean, I think your point.
I tried to do that. I tried to do that some on Twitter and other places, and I was giving, but I just realized really quickly that it's an insurmountable need that I personally can't cover, and so I tried to start doing crowdfunding and encouraging anybody with wealth or any means to join me and to be able to send funds to all these people that need it, as well as it's not it's not just about handouts by any means. It's about creating ways to help everybody in their environment, giving them opportunities to create that ongoing and manifest that and snowball that. So it's not a one-time break.
And I'm glad you're doing what you can do. And I think that's what I'm trying to tell people that are feeling really helpless and powerless. Give to whatever level you can. Sometimes it's just helping get facts out there. For others, it's setting aside a little bit of money to offer. I mean, that's what I was trying to do personally. We got to do what we can do. So I want to kind of switch gears a little bit out of that and ask you a little bit about your career. So you played the role of Malachi in Children of the Corn. That a horror movie is at my heart. And when I was looking at your bio, I saw that and I thought, okay, this is my man.
There you go, bud. There you go. Children of the Corn 35.
I don't care what number. I know they've remade it a few times, but you've gotten to do some big, you're the things you've had roles in: Sex and the City, Homeland, The Walking Dead. I mean, that's pretty iconic stuff.
I've been beyond phenomenally blessed. I mean, I've been doing it for a really, really long time, but still, I mean, if you get one role, you're beating out a million people. So I've definitely won the lottery in many ways of that.
Yeah. And so How do you think, talk about the LGBTQIA plus community. I saw some interviews where you came out talking about your sexuality. Also, anyone that follows you on social media knows that you're definitely part of team sex positivity. You don't shy away from that.
Oh, really?
Seen some of the articles coming out. So what role do you think sexuality's played in your career, or what role do you think sexuality plays in your life now?
I think sexuality played an incredibly powerfully negative role in my entire life, by homophobia and by everyone basically just telling me since I was a kid that sex is private, you don't talk about it. Gay people are weird. It's going to ruin your career if you say anything. And on top of that, it's nobody's business, so just keep your mouth shut. So I felt the weight of that since I was a child. And it wasn't until I finally began to explore the whole culture, our incredible family, our incredible hundreds of millions of us around the world. And I realized everything I had been taught as a kid was a lie. It's such brainwashing, and you start to first of all realize, okay, we're all equal, we're all human beings. Then you invest yourself in your culture and you realize, holy crap, like these people are my idols. These are people I dream of being like one day. And then it just changed my whole world. And then on top of that, while I was doing Walking Dead, I came out. I started doing a lot of volunteering and working with, youth shelters and things. And I just realized, like, God, I wish I had done it years before. And that's everybody I know in the community, is just like, we wish we had done it. We had come out earlier, because your whole life just becomes so much more valuable, and your purpose and your interests and what you're able to do and give back becomes so much more valuable.
Yeah. And I'm glad you are where you are now, though. It's very meaningful. I mean, I work with a lot of clients where representation is so powerful for their family members learning how to accept them and how to see them, but also for their own confidence. We had on the other night Jimmy Wong, who was talking about Asian representation in the new Mulan film and how that's really helped with his community. So what tips would you give for someone from the LGBTQIA community that right now is self-isolating at home? They're not necessarily in the most accepting, warm environments. What would you advise them to do to get through that?
That's hard. I mean, it really is kind of the same thing for anybody. Find your tribe, whether you're doing that through Facebook, whether you're doing that through social media, learn our history. Our history is so beautiful. Contribute to it. And I preach it all the time to, anybody I work with, investors or athletes or anybody. It's so important to be out and proud and visible, because, when people are successful and doing incredible things and yet they're hiding who they are, that hurts millions of us. So, yeah.
Yeah, community is such a beautiful resource, and I'm thankful that we now have technology so that you can kind of access it from anywhere. Otherwise, the isolation would get to us.
Yeah. And I mean, for people that are legit having super hard times, you have Trevor Project. Go on that website if you're dealing with depression, if you're dealing with confusion, and you're at a point of severe problems, go talk to people.
Yeah,
Trevor
and at the end,
is a great resource for LGBTQ with counselors and suicide prevention and people that have been through the dark times and can really talk to you and give you good advice.
At the end of the show, we're going to throw up some resources that people can utilize to reach out to. But thank you. Trevor Project's work is amazing. Yeah. And that's also the purpose of this whole project, I'm Listening, Stay Connected, is we want to normalize discussing our mental health so that it becomes something we're acknowledging, we're working with. Also, some questions came in that I'd love for you to answer with us.
Well, on that note, real quick, before
please.
I answer it, that is, just to be totally outspoken about it, that I'm not a total hornball, but I do purposely and intentionally talk about sexual things on social media for people that are uncomfortable, that they never hear about our lives and about our sexuality. And so rather than it being so polarized and so scandalous, I think normalizing it is really important because, a healthy life, a healthy sex life, and education on that is so important. So that is part of why I'm so outspoken about those things, just to normalize it and to bring some of that to people.
So thankful you do that. A lot of people in my field try to separate mental health out from sexuality and sexual health. And it's kind of the work I'm doing as well. They're so deeply married. We can't have shame about our sexuality in any form or our body and think we're going to be mentally healthy in the world, right?
Boom. Yes,
That's right.
sir.
All right, we got some questions. Daniel, this one comes in and asks, I read about your experience with hospital bills recently, so I just wanted to know your thoughts on people who refuse to go to the hospital in fear that they'll be in debt. I'm one of those people, and it's hard knowing I'd rather get sick and take my chances than rack up bills.
I mean, that should be on every major news channel. I mean, that it should just be echoed constantly. It's so, and I don't want to cuss on your show, but it's so infuriating that we have trillions of dollars, and then the people, our American citizens that are paying taxes, that are contributing to society, are afraid to even get health care during a pandemic, which essentially, that's not even selfish. That's taking care of America. Because when you get tested, you are therefore aware, and you act different, you behave different. So that's a part of the whole story that just infuriates me, that people are uncomfortable because they're going to have a bill when they're trying to protect their community.
Heartbreaking, right? This question's a little more lighthearted for you. This one asks, first off, Daniel, you're a snack. I'm sorry, no, it says, first off, you're not a snack. You're a whole damn meal. Is it hard for you to date with so many people thirsting after you? I think this person's interested, Daniel.
Oh my God, who is that? That's the sweetest thing ever.
So what's it like dating you, Daniel?
Oh God, I feel bad for anybody. I feel terrible. Oh, it's funny. Yeah, I'm definitely not a snack. I'm from Georgia, so I'm a buffet. I am way too much. Speaking of, I need to go back to the gym desperately. That's all I'm doing now is just eating. What is it like dating me? Oh God. Next question. Let's just change the subject.
I think you kind of answered it. It's complex, but a lot of fun, right? All right. Fair enough.
Definitely a lot of fun. I'm definitely loyal. I definitely am. I try to be super thoughtful, but oh my God, I think I would hate to date me.
Wow, we got you to blush. Okay. We'll move on to the final question that came in.
But I'm a ginger. That's natural.
All right. Well done, sir. This one asks, do you believe that ignorance is bliss when it comes to news around COVID-19 right now? Not sure if it's better to just turn off the news and do my part with distancing and sanitizing, or if it's actually important to understand everything going on right now throughout the country.
Oh, that is such a hard question. I mean, it's finding that balance. I would definitely tap into several credible news sources each day to check in, see where we're at, because you definitely want to be informed. But yeah, don't play into it. It can definitely drive you crazy. It can definitely lead to way too much anxiety, trouble. So just be informed, and definitely be well-roundedly informed from different sources.
Beautiful. Daniel Newman, thank you so much for your time. Thank you for everything you're doing as well. Thanks for being part of the show.
Very privileged to be on here. Thank you so much for all you're doing.
Beautiful night.
Stay safe, everybody. I appreciate that.
You too. Yeah, I mean, I think this question about how much engagement we should have with the news and everything that's going on is a really important one, because when we talk about mental health, we have to know that what we essentially bathe our psyche in is going to have a direct impact on both our physical health and our mental health, because again, our immune system and all the different systems are all interconnected. So, Yeah, you want to be up to date on the facts, but again, if you want to be sleeping well through the night and you want to have your nervous system getting a little bit of a break, definitely take some time away to do some self-care. I'm reminding everyone I'm working with and here on the show, joy, fun, we're taking everything seriously, but we're also allowed to take some time away. And again, let our nervous systems just kind of cool off. Don't want to keep ourselves in a constant state of tension. If you want to join the conversation, you can always do so by sending your questions into our Loveline IG page DMs or by tweeting your question to hashtag I'm listening. I have some questions here that came in. This first one says, hi, I know someone who had mental illness, took some time off, then his employer wouldn't let him work again until he agreed to a set of rules using his mental health as leverage. What should that person do? Yeah, that's hard to hear. We want everyone to be comfortable and confident talking about their mental health, right? That is a part of mental health, is the ability to acknowledge, to talk about it, to share it in appropriate venues. Shame or guilt around our mental struggles are not going to help us. So it's always disheartening when I hear that someone was forthcoming and vulnerable and it was used against them. I always say a couple of things. Talk to HR. I mean, they're there to support you and to figure out what's needed to be done with you and your employer. We also have the American Disabilities Act, and that's something that protects you from discrimination based on mental health issues. So I would say that, and always document. But yeah, definitely get the support you need. All right, now we're going to be joined by Dr. Daniel Newman, psychiatrist and brain disorder specialist. How are you? Thanks for being part of the show.
Well, thanks so much for having me.
Absolutely. So your new book, The End of Mental Illness, I've been sitting with that for the past 2 weeks. Amazingly comprehensive. I'm familiar with your work prior to that, but you literally put everything in this book.
Well, it's a big promise, and I wanted to back it up. There's over 1,000 scientific references, but I think mental health as it's currently practiced, making diagnoses based on symptom clusters with no biological data, is just wrong. And I believe we need to break this current paradigm and create something completely new, which is based on brain health, not mental illnesses.
And what I think was so beautiful as someone, my career began with nutrition and food science, and then I moved into psychology, and I wish that nutrition had been something that was consistently folded in. So I was happy to see that you were someone to really prominently discuss the intersections of nutrition and brain health. But let me ask you this, sticking with that, right now in the pandemic, how would you, if at all, differently talk about the shift from mental illness to brain health as a result of what's happening with COVID?
Well, I think the pandemic is going to increase the already epidemic rise of mental health problems, brain health problems around the world. Suicide is already going up. Calls to suicide hotlines have gone up nearly 1,000%. Anti-anxiety medications skyrocketed last month. It's not good for our brains or our minds when you turn on the television and all you see is death and destruction.
Yeah, and people will come to me therapeutically asking for a way to cope. And there's not always a reframe. Some of it, unfortunately, is me delivering the message that we should be scared of some of this. What tips, and looking from, as you said, the brain health perspective, what tips would you offer specifically to people with stress and anxiety right now in the pandemic? The most important ones.
Mental hygiene is just as important as washing your hands, that we need to disinfect our thoughts. I call it kill the ants, the automatic negative thoughts that steal your happiness, and be more disciplined than ever about brain health. So, for example, my routine starts with sleep. It starts the night before, but really making sleep a priority. And then when I wake up in the morning, I say to myself every day, today is going to be a great day. Why? Because then my mind will find why it's going to be a great day. And then I ask myself throughout the day, is this good for my brain or bad for it? And you just have to know the list. And that one little 3-second exercise can dramatically change the health of your brain, which then improves the health of your mind.
And is that what you mean when you talk about mental exercise? I know a lot of us in our culture are very familiar with physical exercise. It's prioritized, especially here in LA, but no one often talks about whether or not they're doing the mental exercise. Is that how one would go about doing that?
Absolutely.
Okay.
It's you're directing your mind rather than your mind taking over you. And second graders can learn how to kill the ants, the automatic negative thoughts. But there is nowhere in school that we teach kids how to do that. And we don't teach them how to take care of their brains. We have a high school course that's in all 50 states and 7 countries where we teach kids to love and care about their brains. And what we found, it decreased drug, alcohol, and tobacco use, decreased depression, and improved self-esteem. People just don't get that mental health comes from, or mental illness comes from, the physical functioning of your brain. And when your brain's not right, you're not right.
So let me ask you this. People are talking a lot about different ways of coping, and I'm seeing the Facebook posts. There's a lot of people that are starting their day or their midday with the alcohol use. There's a lot of caffeine. There's a lot of consumption of sugary foods. Speak to that, because I know your book covers that a lot. It seems to fall under a lot of the categories of things to avoid for total brain health. So when you see those things coming up on the social media, you must shake your head.
Well, in the book, I talk about if I was an evil ruler and I wanted to create mental illness around America, well, what would I do? And I would do just those things, because alcohol is not a health food. Marijuana is not going green. It hurts your brain over time. Caffeine constricts blood flow to the brain. If you're asking yourself, is good for my brain or bad for it, they're starting with things that are bad for it, which means they're going to pay for it in their ability to concentrate, their ability to manage their anxiety. And ultimately in a pandemic, and you alluded to this, the don't worry, be happy people die the earliest from accidents or preventable illnesses. And now their grandparents are going to die the earliest because they weren't thoughtful enough to wash their hands, to physically distance. I hate the term social distance. It's wrong.
Right.
We need to be socially connected. We need to be physically distant for this time. And so if these posts indicate they just are engaging in bad habits, there's going to be a consequence to that, which will be an increase in brain health, mental health problems.
Well, I like the way your book covered it, because I feel like I'm the mean dad when I'm on my social media and telling people to chill out on the drinking, think in terms of nutritious foods. So before we go to some questions that came in that I'd love for you to answer with me, I wanted to ask you about something specific that also came out of your book, The End of Mental Illness. And you started by saying how important sleep is for total brain health, also for our immune system. You mentioned blue light blocking lenses. Speak to us about the connection of our technology, lighting, and sleep.
So I'm a huge fan of blue light in the morning. In fact, it's been found to be a treatment for depression. But if you have gadget light, blue light, after dark, it decreases the production of melatonin, which then means you're not going to get or stay asleep. And so putting blue light blockers on your phone, wearing blue light blocker glasses, it's just a mental hygiene thing that you should do on a routine basis so your brain can produce the hormones you need to sleep.
And thank you for pointing that out, because that is among the top issues I see coming into my practice, is people struggling with getting to sleep, staying asleep, and waking up feeling very rested around sleep.
60 million Americans have trouble with sleep. And now with the pandemic, nightmares have gone way up, because dreams help people process the stress that happened during their day. So protecting your sleep. When you sleep well, it turns on 700 health promoting genes.
Wow.
And when you don't sleep well, you're more vulnerable to being sick. In fact, in the book, I talk about the 11 major risk factors that steal your mind. I have this mnemonic, bright minds. And so many of them are the risk factors that kill you if you get COVID. So, for example, being diabetic or obese, having hypertension, having inflammation in your body, you want to start taking care of your body because ultimately it nourishes your brain.
Yeah, I mean, look, I'm always preaching about self-care, and it's something I've had to learn to practice myself. So no matter what's going on in my life, I always enforce 7 to 9 hours of sleep because, like you're saying, it's such a cornerstone of so many other pieces. We had 2 questions that came that I'd love for you to answer with us. This first one asks, I'm feeling really slow lately. I don't know if it's the lack of exercise or routine, but my mind isn't as sharp as before. My attention span's out the window and it's hard to grasp new concepts for some reason. Any idea why this might be happening?
Well, there's a whole bunch of things that could be happening. I mean, one, the boredom and the poor routines people are in at home will clearly disorient you, but you should check your thyroid. I mean, it's the first thing I think about. If your thyroid's low, you feel slow, you feel sluggish. Hormones, that's in Bright Minds, it's the N, neurohormones, major cause of brain health, mental health problems. Nobody knows. We should get our hormones tested and optimized on a routine basis.
Final question asks, does a change in overall mood or mental health state hold any weight right now, considering we're all going through a rough experience? How seriously should people take mental changes right now versus prior?
They should take it very seriously. There are actually a lot of people who are thriving during the pandemic. I don't know if you've heard that. I'm on the radio every week in London answering questions. And I've had a number of people who are schizophrenic said, I feel better than ever before because the whole world knows how I feel, which I think is hysterical. But people are taking time to reflect on their lives, to really ask themselves what's really important. I've seen families bond and are closer now than they've ever been before. If your mind is beginning to sort of fall off the cliff, it's a good idea to get help.
Beautiful. Dr. Daniel Amen, thank you so much for being a part of our show. Have a
Thank
beautiful night.
Thank you so much for having me.
Goodbye.
Care.
Beautifully said. There's so many things we have to be considering right now, but I know that we can water it down to a few basic things. Sleep hygiene, so important. Nutritious foods. And as always, look, I'm going to be on your backs about this as much as I can. Be really thoughtful about what we're eating, trying to get rid of the smoking, and kind of reducing the alcohol consumption. I know it's hard because on one hand, we're saying use the coping mechanisms that are needed, but we also want to think about the long-term impact they're having on us. And as we just talked about, also on our total brain health, because coming out of this, we want to be doing better if we can, neutral at least, but I don't think we want to do further damage than what's already happening with some of the mental health things that are percolating as a result of the anxiety, the fear, and the self-isolation. I have a question that came in. This one asks, what is a good way to identify the cause of a dip in mental health if nothing major occurred and nothing is technically wrong? What steps can I take to see what the underlying issue is causing my gloominess? I'm a big fan of people pausing, taking a moment to reflect from the outside at what that mood is and ask yourself, what might it be saying? It's an interesting exercise. If this mood could speak, what would it say? What would it be asking for? Because sometimes our mood is a request for something. It's asking us to be thoughtful about something, to honor something, to change something. We don't always want to immediately try to reduce, get rid of, distract. There's something really valuable in looking at our moods. They're telling us something. And that's what some of the work is looking at what transformations need to happen in order to shift that. Coming up on our next show, we've got Nicole Alvarez, a radio personality from K-Rock, and Dr. Vivian Chan, medical doctor and also epigenetic specialist. That'll be on our next show. I want you guys to go forward thinking more about self-care, paying attention to your sleep habits, the food you're eating, and as Dr. Amen said, your total brain health. It's something that's going to impact our total body and also our psychology. Thank you for sticking around and joining us. We'll be back at 5 p.m. Pacific Standard, 8 p.m. Eastern tomorrow. You can check us out on all the radio.com handles, full episodes, and go back and rewatch some. Thanks for hanging out, and you all have an awesome, awesome night.